Hi, today I'll be doing a reverse diabetes book review. So I have 7 books here, starting from the best book. The best book I think is this by Roy Taylor. Roy Taylor is a professor of medicine in Newcastle University in UK. This guy, his major contribution I feel is because he led a few researchers. The latest one was called the DIRECT trial. DIRECT trial is the first clinical trial in the world that proves that diabetes can be reversed. um, yeah, and this book is very good because it explains the mechanism of diabetes. Type 2 diabetes is because of insulin resistance. Insulin resistance is caused by uh, too much fat accumulation in the liver and the pancreas, correct? So what is insulin resistance, how the fat can cause insulin resistance, all this is he's explaining. So when you write clinical trial, because it's funded by the NHS, so NHS won't simply give you money to do a clinical trial unless you are very good. Okay, so this guy is the world class lah. He's a world class researcher. Okay, he has done many researches, and so he has published a book here. But the thing lacking about this book is he doesn't tell you what to eat and what not to eat. So this is 2020, this is 2021, also by Roy Taylor. This book is more practical guide lah. Okay, your simple guide to reversing type 2 diabetes. The 3-step plan to transform your health. So this book is supposed to be practical, but I also feel that this book is not so good because it doesn't explain to you what you should eat, what you should not eat. Okay, it just is still not complete lah. I feel it is accurate, it is good, but I feel it is not complete because it doesn't talk about vegetarian diet. It doesn't talk about the pros and cons of a high protein versus a low protein diet. Whereas this book, you can see the pictures here. These are all vegetables. So this guy is more like a vegetarian. He's promoting more of a vegetarian diet. The End of Diabetes by Joel Fuhrman. Okay, but the only problem with this book is actually not really. There's no problem with this book lah. It's very scholarly. So there are about 20 pages of references. So all the references are here. He has 20 over pages, all references, you see. So this is a very more like a scholarly book. Okay, it is it is good. It's a New York Times bestseller as well. New York Times is from US lah. So this is the 4th book. This guy is also very famous. This Neil Barnett has been promoting reversing diabetes for 20 over years, as far as I know. Since the 2000s, the early 2000s, he has already been talking about it. So a lot of his ideas, a lot of his research, this guy also, I think he has published about 300 scientific journals, medical journals. So this guy has a lot of original findings that other books don't have. But the problem with this book is it is very boring. Okay, I couldn't finish this book. I haven't finished yet because it's very boring. But some of the points in this book you cannot find in the rest of the books. Okay, so this book is not written by doctors. It's written by 2 guys. One guy is a PhD in biochemistry. One guy is a master's in public health. But these 2 are type 1 diabetes patients. So they are promoting vegetarian diet. Okay, strict vegetarian diet, and they managed to reverse their type 1 diabetes. Means they don't need any glucose lowering drugs, but they still need insulin for type 1, of course. But very minimal insulin and no drugs for them. So it works on them, and they have set up a so-called a practice a consulting practice. So they help people, they have helped maybe thousands of people, according to them, reverse their type 1 or type 2 diabetes. So this book, if you want to know the pros and cons, why you should have a vegetarian diet, what is the benefit of it, then this book is a good book. Yeah. This book is written by Dr. Jason Fung. So this is a doctor in Canada. He's a nephrologist. This book is a bit not so complete, and it's not so practical. Okay, it doesn't tell you because it tells you you can eat a lot of fat. So it tells you there are good fat and bad fat. Good fat is nuts, fish oil, vegetable oil, avocados. Whereas bad fat is like animal fat. You want to avoid the bad fat. And this guy promotes protein, but the problem with this guy is he doesn't want to eat carbohydrates. He doesn't want diabetes patients to eat carbohydrates. Whereas these guys, okay. So these two is not so good because they are too biased already. They are too biased. They are not yeah. But this one, he has a very he explains about insulin resistance in this book, like the diabetes code. So the last book is by Dr. David Cameron. This is not very original. So what this guy do is he learned from other doctors, from all these other doctors. He follow with his patients. He promote it to his patients, and then it works for his patients. Then he found it works. Then he write a book, but it is not original, and yeah, so not so good to read okay. There's one more book. This book is very, very practical. Okay? It is by far the most practical book of all. If you have diabetes yourself, this is the first book or the second book you should read. Besides Roy Taylor, just read Roy Taylor and this book enough. Okay, so this book is called the Type 2 number 2 Diabetes Diet Book. You can get it from Kinokuniya, but you have to pre-order it and I don't have a copy because my copy hasn't arrived, and I read it from I borrowed it from a library. So the reason why this book, one of the major contributions, is because it splits the diabetes diet plan into 3 stages. So you have the weight loss stage, you have the maintenance stage, and the normalization stage. I think they call it normalization stage. So the weight loss stage is the first 2 to 3 months. You want to lose as much weight as possible, so you eat about 1000 calories, right? A normal meal needs 2000. Normal man need 2000. You only eat 1000 calories, so you lose 1 kilo every week. So 3 months you lose 12 kilos, around there, depends on your weight so once you lose all the weight, then it helps. Then the maintenance stage, you start to exercise a bit. Maintenance, you start to increase your food intake, slowly increase, and then when it comes to the final stage, the normalization stage, you start to eat like normal. You follow the normal diet, you start to become more normal. So because he has a very practical, because he tells you step by step why you have to do what you have to do, not just what you have to do, but why you have to do it, which is important. So it is more for patients, people who are suffering from diabetes. Okay, thank you.